Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I want to cover this case we talked about in the video before on the impacted wisdom teeth that they'd had, and when you should want to take out wisdom teeth is when they're going to be a real problem prior to maybe a few years later. You need them, but if you have room, you want to keep them. But we're going to go ahead and cover some other problems that this case has in addition to the impacted wisdom teeth. And I'm going to go ahead and start doing this. Let's see, I think we got to get this going. This young man, I've got a whole lot of film here now. I want to just cover it as fast as we can, and I don't mean to rush you too much, but this is a young man. He's smiling. He's got a little space between these front teeth, and a nice kid, but he's got a little tartar and a few other problems with doing this. And we have a frenum up here that looks like you would have to go in here, but I used to cut a lot of these and take them out, everything, but then as the big cuspids come in over on this side, it'll push this teeth together, and frequently you don't need to mess with the frenum. But if you see one of the parents that has this big frenum, then you probably should start off and reduce this, take the ligament out of there, and let these teeth come together right here in the front to start with. But you can go ahead and do this, and if you need to do the frenum later on, you can do it then. There's a lot of rotated teeth here, crowded problems, and a lot of things that we'll want to cover. I'm going to have to move on here pretty fast. We've got a lot of pictures of this case. Now you can see the molars coming in back here. The second bicuspids, cuspids, and the first bis, and then your cuspids are going to be right in here, but they're impacted, and they're really impacted. So you'll have to look at that as we get here. Now there's it looks like a portion of one of the teeth is still in place. Well, this is a deciduous tooth coming out, and it'll just be nothing but a hull, and this is another part of a deciduous tooth that's just rolled out to the side. As the permanent tooth comes in, one of the roots has stayed longer, and that's forcing this tooth in, and that's just part of what's happening in here. When this is gone, this tooth will come back. But if there's part of this root that's keeping it there, you ought to take the root out and let the bicuspid come back over and stay in the area. And you can see these teeth sitting right on top of that right here. Now over on this side, we've got a funny situation where this tooth was probably growing in at this angle, and then it's turned and it's coming in out of position. Now, rotating a tooth like that is pretty hard to do, and you can see this tooth is developing a crook to it also. Now, we've got a gap here that needs to be considerably bigger, and time we push all these together and get this, it'll increase the space for that, and we will show you a special way of opening that space and keeping the roots parallel. And I think it's Dr. Broussard is the gentleman that started using this kind of a deal that goes kind of like up and down, and you can tilt this out and make the roots go this way, or you can tilt this one in and make the roots go the other way. So you can handle the expansion of this, and you can parallel the roots with this little wire that we'll show you how to put in as we get there. Now, another thing I wanted to bring out is that when this tooth is absorbing the deciduous tooth, it eats the total root away, but it does not affect the crown. You'll get the crown of this baby tooth will come out, and it'll just be a hull of the enamel. So the resorbing cells that pick up the dental portion of the deciduous tooth have no effect on the crown. And that's sometimes this crown will get hung underneath the tooth, and you need to understand that, so you have to go and either flip it out or get it taken care of it. And I've seen these come out and just be nothing but the enamel of the tooth left in there. Now we've got an impacted cuspid over here, and we showed there's one in this area and one nothing up here, but we have one over on this side. This is some we showed before coming in there. Now we need to look at this and really study what you're going to do. You don't have to worry about this frenum in here, because when this tooth comes in, or when you open this space, you're going to have to shove these over. Now if you just push these teeth apart from the crown down here, which your archwire would do, the root will rotate at a point somewhere along in here, and so instead of that root being over here, that root may come in this fashion. As you open this up, it'll rotate and put the root over there. You push on this, pushes this root over. Now having this root go over is okay. It will bump the tooth, it'll bump against the follicle and actually move the tooth before the root touches the enamel. This is a bigger problem over here. We got to impacted cuspid is usually lingual to the to this lateral right here. So as we push this apart, we have to watch where this is going to go. So let's take a closer look at that. And now we put these little brackets. This is the kind the ladies that work in the office we've used so long, and they know how to place them, and they know how to put little wedges under them if we want to rotate teeth with them, and we do that quite frequently. But these take up a lot less inter bracket space. You've got this much room in here, in this space, where if you got double brackets in here, your room is cut down considerably. So you can make a lot bigger bends in here, and you can do more torquing and more moving and more everything if you have more space in between the teeth. But it's harder to get the tooth rotated properly with these without any springs on it. But we want to look at this one over here now. That's the one that we're dealing with. We need to widen that gap out, and I think we're going to get a closer look at it here in just a minute. This is the other side, and here this side is at the main space we want to open is right in here, and there's about half what we need to get this cuspid coming down in this space. Now what this is right here, it's a little V coming up, down, up, down, and up through the bracket right here. Now, you say, well, that's no big deal. What's so important about that? I'm going to click here and make a white page and show you what we do. Like you would come down with this and up and down and up and down and up and down, and this is not. Now this last one is the one that's going to go through the bracket. So it will be in the bracket. We can bend this so when you put it in there, you can have it laying like that, or you can have it this or this, and you can put it in the bracket, and you can mash this little V right there, like you come in here and you take your pair of pliers and mash that, and it'll bring this out and this out down here. Like you can flatten this out, and these will go out like that. In other words, you can expand that by pressing this. If you want to bring them the other direction, you press right in here, and that'll make this one go this way and this one here. If we want this to go more, we press right in here, and it pushes these two teeth apart in here. So we've got teeth that we want to enlarge the gap here, and we want to push the teeth so that the roots go apart with the teeth. And this is a neat little deal, and Dr. Bassard, a man who worked into his 90s too, used in doing this. So I'm going to go back here and punch this again, and you can see. Like, if we spread this thing out, in other words, it's pushing this way and this way down at the incisal edge, and your angle that you push this angle here is pushing the roots of the teeth out at the same time the crown is going out. The roots go out here, and the crown goes out. So you can take a little gadget like that that's as simple to make, and you can, well, you have to kind of round the points up so you can mash that, and it makes these legs go out. And you can push this any way you want, and you can expand the teeth out, or you can pull them in with it if you wanted to. You could reduce it by shrinking that, and then the way you bring this in, you can carry the root with the crown. So this is an important little piece of orthodontic bending that you can put in, and then you run it through the vertical slot, and you have your regular arch wire going through like that, and you can make that opening. You can just take it and carry it like that. You don't do it this way. You see, if you just push it, the roots would go together. Or you can push something up here and maybe they go apart. But this you push at the bottom and the top of the tooth, and the tooth will just go apart bodily in that fashion. Now that is a very important little wire to learn how to bend. So I hope that everybody seeing this right here, it will show you how to do this type of work. Now we needed to open this space in here, but if I just push the crowns apart, the roots are going to come back toward one another. But with this in here, as the crown goes over here, the root goes with it. And this will go this way, and this whole thing will move over like that, and open up a space for this cuspid to come through. And then when I show you that cuspid on the x-ray, you'll kind of understand better what we're talking about. Here we are with the lower arch now, and we're also doing some work on it. You can see we're rotating this tooth. We got a little wedge in here, so we're going to bring this around so that this is rotated in this direction. This one needs to be rotated, and so we've got one of these ledges, little plastic wedge in here that'll bring that over like that. So anyway, here this is again now. We have opened this gap some, and you'll notice that this tooth looks like it's leaning that way, and this one is coming this way. So as you push on this, you're out in front of it. It's like hitting a ball. You tend to rotate the tooth in that direction. And so you have to have it tied down in here with a regular arch wire coming across. And so you use 2 arch wires to here, or if you want to call this one an arch wire. It's a wire made to expand and control the way the roots are. And there's an excellent, and you run it up through here and bend it over a little bit, run it up through the, see these brackets have a vertical slot in them. So you can't see it from this angle, but it's got a vertical slot in the bracket. And they're good little brackets to use. And by the way, I can take those little brackets or those with wings on them, which we recommended. Here is the little wedge, the plastic wedge you slip under there. It'll make this tooth turn in this direction, like that. And so you can stick those in if you want to rotate them a little bit further around, like that. All right, there we are. Now, if I flatten this, it's going to make these legs go out this way. In other words, it will push more down here. It's going to bring the crown of this tooth over in that direction, and the wire will bend over and make that one go in the same direction. All you have to do is just mash that little center part to get it to operate that way. Now we go over there and mash it again there. All right, here's where we want to bring this crown. We've got to get this root way over here, and sometimes we have to take these roots and print them together and push this way over to start with and make room. Now this one won't need much, and this tooth will just come on down. As it comes down, it'll tend to push this together, and you push this one over, and you push here too, and it'll close this space, and you'll move these 2 teeth over, and you'll move the roots over, and in this tooth, we can start it down into the opening right here. Now I'm going to go through, this is number 1 x-ray, and I took a whole slew of x-rays here. I don't know exactly why we did, but look at this is just barely touches. Now this is a follicle around this tooth, and this tooth is lingual to the other one. Let's look at that. Now there, that's little spot that's opening, and it's pushed those roots that way. It's opening this big, so we're going to get this tooth and head it down in that direction. We still had problems getting it in. Now the gap is closing up, but we're working on those impacted teeth. We're expanding the whole lumen thing here. This is pushing, all these teeth are moving out in this direction. We've got this loop that was out further. Now when I push back here, it squeezes this, and we're doing that on the other side. I'm covering this as fast as I can here, and we wanted to change the position of this tooth more, so we dropped it. You see that little bend right there? That makes this go more, and I push pressure on this, and the spring is pushing the root over more than the crown, and we'll put these roots together up here and make as much room as we can, and we're going to get this tooth to back off and come down in that gap. So if you're interested in doing it or seeing how we're doing it, now we're closing a space everywhere. All right, you remember this tooth used to be further, well, it's over the back. It doesn't have any movement in it. Well, this was number 1. I don't know what I'm doing there. This is number 2, and you see this is better. this a little bit better. We move number 3. We take that wire out, take that bit, and you look at this tooth right here now. It is pushed over, and we're pushing on this, and that pushes the root against the follicle, and this tooth is changing angle. If you go back and look at the angle there, now look at this angle coming in here. Now we move this over, and we're bumping that, and we're opening up a gap here. Now watch that tooth move. This drop down, drop further, drops a little bit further, and number 5. This one is, the follicle is actually moved it away from this tooth, and the follicle over here is in, but this tooth is being pushed in this direction. Now that's number 6. Number 7, it's coming over pretty good, but we were still having some trouble with it. And he's age 14, and we've been working on that, trying to get that to come down. We've got, see the roots of this one out here, the roots of this one, actually they're touching the central roots here. So we've got a space in here this big, and this tooth can move into that space if we had to. So we decided to go after this tooth right here and pull it over to that space. Now we go in there and operate on it, or else I sent it to an old surgeon and had a little hook made, and he bonded onto that tooth, and we'll come out with this, pulling it back in that direction, and just turn that tooth down in that opening. So here we are, the tooth going down, but it's sideways. This one came in perfectly fine. We're going to have to turn this tooth around after we get it down in the mouth. Now you can see the wisdom tooth here, and the wisdom tooth, well, I don't see one up here, but and we've got one on this side. I don't think there was even one up there. And this one is coming. Now this is the type of tooth here going in that's going to make this drop, or it increases this angle. The gonal angle down here will get bigger, and it means that this is coming down here, and you may not want that to happen, so you're going to come in and eliminate these wisdom teeth on the bottom. Now this is coming good. We've taken this one and turned it, and now it's coming in. This is number 10. We took a whole slew of Panorexes on that. Now that tooth, you would not know, it was setting up like, maybe more like that. And now it's rotated down. But we've been pulling from the outside. I'll have to show you the deal. So we've got it over there now. This is age 15. We've been in here a long time on this young man, and this is number 11. And we left these alone as long as we were in there, but we saw he was not going to grow a lot more, so we wouldn't have room for this tooth to come in, so we're going to prepare it. We're going to take those 2 bottom teeth out down there. Number age 15 and 4, and here that's age 16 and 7. That's another year. We have eliminated the wisdom teeth, and there was not one over here, and we took this one out, and this one we just leave alone. It doesn't bother us, and we've lined all this other stuff up, and those cuspids, you would never know that they were laying down like that up here. And so this is pretty well drawn to the edge. Now there's how we sent this to an old surgeon, I remember now, and they bond these little gold chains onto them, but they make a hole in here big enough to really get to it. You can make a big hole in the palate and it'll close up. But you cannot come in from the buckle. You have to be very careful with that. So this hole will close up right there. And we'll slide that tooth over in that place, and we've opened the gap big enough, and we pull it up in there, and once we get it in there, then we'll rotate that tooth around in that spot. So this is a complicated, long-term impacted, and we're using our spring method of opening the gap some more here, and this spring is pulling that tooth toward this little section in the arch wire there. So there, this is coming to this spot. We made a loop, and you take that arch wire when it comes, and you come up where you want it. You just make a little loop and hook it, and then you run this spring on each side of the loop, and you pull it. Here's the tooth, and it's going to that circle you put on the wire. All right. Here it is, 903, and we've got the lowers lined up good. We got second molars banded, everything. Now here is the spring. This is pulling, and it has dental floss going back. It's pulling that tooth to this spring. And these springs there's just one spring actually, and we can push here and here with a certain amount of force, and it can slide over the arch wire. And now this one spring is pulling out from there. You covered that being impacted cuspids, or just developed this method that you'll put the force where you want it. It'll last the whole time. And now we're coming there, and we'll have to rotate the tooth. So we got the tooth in here now. We're going to turn that thing around and line it up, which we do with the elastic thread. Now it has to be rotated. And we've got a step-up arch in there, and we're pulling it to that point. Now it looks like 90 degrees rotated at that point. And so we're going to hook onto it. Now you see we tied this elastic chain, wrapped it around, put some acrylic here to keep the elastic down. Put the elastic over the bracket, but not over the arch wire. And that is the turningest thing you can possibly get, and that'll bring this tooth around in that direction. And so, looks like that's the tooth. Now we got it around, and now we're pulling it down into space. And we ended up with it. So I'm going to say goodbye. We took quite a bit of time there, but it was a long, drawn-out case getting those impactions in the mouth. So I'm going to close out now. Hope you'll join our group, and thank you for tuning in. I want you to subscribe.